I'm in healthcare because one of the worst experiences I had as a kid was experiencing the death of my grandfather. For me, knowing that that had happened, believing as young as I was that there was something someone should have been able to do about that, really launched me into how can I make a difference in people's lives.
You know, it was probably early on when I was first getting into business and sales, and just realizing that you can truly make an impact on people's lives. So that's driven me from early on.
I learned long ago that the role of a leader is to have a clear vision, communicate that vision to the organization, and then reinforce the focus on that mission with the processes and structures that the organization lives by. We try to be really intentional about making sure that we're communicating and aligning our organization at the mission. The focus has to be that first.
Our mission of access and outcomes, it has not changed. If you look at the core things that we need to do as a society, but also as CQuence, it's really making sure all people of all socioeconomic class have access to good quality health care. And then in the end, it's about outcomes.
So I think the idea of hitting 1 billion lives would be phenomenal. It's really our marker. Our mission's very different than that. It's not for us to stand back and throw a party because we hit 1 billion, because the billion isn't what matters. Every one individual life of that billion is what matters. And that one life has an impact on lives around it. So when we think about how we get to the billion, we can't do that alone. Our portfolio really then is our opportunity to broaden our impact, bringing in others who are innovators in the healthcare space and allow us to touch more and more lives, having impact on people's healthcare journeys.
I think it's very aspirational goals that we have to drive access and outcomes and impact 1 billion patient lives by 2030. So you really have to make sure that we're aligned, but also making sure your solution meets the needs of the patients and the healthcare system.
You know, one of the companies that we've been involved with since its inception is DocPanel. They've built, without any question, the largest subspecialty teleradiology practice in the country and probably in the world. Their ability to provide both high quality reads, but in addition to that, they've also got a side of their business that's focused on patients bringing their data and asking for a second opinion. DocPanel can help those patients connect not just to a doctor that can help them, but to a world leader.
I think if you look at what we've added in the different companies and areas we've grown in, I think we're just having a bigger impact. I'm excited to see where all these companies go and what we add. So all those pieces that we have are really helping to transform both CQuence, but also how we deliver healthcare to the patients.
The reality is that lots of the innovations that will change patients' lives in 1, 5, 10, 50 years are things that are being worked on today in the back of someone's mind, in a lab, in a garage, or by somebody who's just simply right now in high school. Those are the things that will change lives in the future. And our job is to help identify those early, push resources to help them not only be successful as an idea, but to scale as a business. And that in turn then multiplies the impact that it gets to have on the world. That's the thing that most excites me about what I can do, but it's really working through CQuence, is making sure that we have the best organization possible and the right portfolio to be able to replicate that process over and over.